Communicating for Antibiotic Stewardship. This video is part of the Communicating for Antibiotic Stewardship series. Videos in this series provide evidence-based training on fundamental communication skills that primary care providers can use to reduce patient expectation for antibiotics while maintaining their satisfaction with care. Improving care for international students. People from around the world come to the United States for higher education and employment. Healthcare policies and practices vary widely from country to country, including how patients access and pay for healthcare, norms for provider-patient interaction, and the extent to which antibiotics are regulated. These differences, along with language barriers, can complicate the provision of healthcare, including the successful practice of antibiotic stewardship. Your objective is to overcome these challenges so that international patients are more comfortable seeking care from U.S. providers and less likely to use unnecessary antibiotics obtained from their home countries. This short video provides practical, research-based guidance for communicating more effectively with international patients. Specifically, this video presents 3 strategies that can be used individually or in combination to help improve international patient satisfaction with non-antibiotic treatment. These strategies are: A. Learn from your patients. B. Explain the need for antibiotic stewardship. And C. Provide extra help with medications. A. Learn from your patients. Most healthcare providers don't have time for in-depth study on the use of antibiotics in other countries, so their knowledge is often limited to generalizations. These can lead to inappropriate assumptions about what patients know or expect from you. Fortunately, being patient-centered and learning what you need to know about your individual patients can help combat this. Start by acknowledging that there are differences between the way medicine is practiced in the U.S. and other countries, and encouraging your patients to ask questions and share information. This might sound like, "I see from your chart that you've come from India to study. I realize that healthcare looks a little different here, so please ask me questions about anything that seems unfamiliar, and share anything you think I should know from prior doctor visits." Later in the visit, you might say, "I realize that every country has a different approach to healthcare, and I want you to leave happy with the care you've received. Do you have any concerns that I haven't yet addressed?" These strategies give you the opportunity to learn your patient's concerns, which might invite conversation about antibiotics or something else that warrants discussion. B. Explain the need for antibiotic stewardship. Because people from other countries may have experienced different norms for antibiotic use, it is essential to explain and promote antibiotic stewardship. Key points about stewardship include: 1. Antibiotics only kill bacteria, not viruses. Many common illnesses are viral. 2. In the United States, healthcare providers determine when antibiotics are appropriate for the illness. 3. Inappropriate antibiotic use encourages the development of bacteria that are resistant to antibiotics. And 4. Inappropriate use includes unnecessary use, using antibiotics without a prescription, and sharing antibiotics with others. To communicate these ideas, you might say, "Because I don't see any evidence of a bacterial infection, and I want to protect against antibiotic resistance, I'm not going to prescribe an antibiotic. Instead, I'm recommending other medications that will help you feel better while your body fights off the virus." Remember to be especially diplomatic about access to antibiotics in a patient's home country, or antibiotics that might have been brought into the U.S. from their home countries. If needed, calmly acknowledge this as a fact and non-defensively explain the basis for your own treatment approach. For example, "It's true that antibiotics are sometimes available without a prescription in countries outside the U.S. The challenge is knowing when antibiotics are going to help you and not create bigger problems like allergic reactions or antibiotic-resistant diseases. Since you don't appear to have a bacterial infection, My best medical advice is to avoid antibiotics at this time. I'll help you choose other medications to relieve your symptoms. C. Provide extra help with medications. Remember that the U.S. names for medications may be unfamiliar to international students. To help your patients obtain and use the correct medication, provide a written list of prescription and non-prescription medications with both brand and generic names and what they are intended to do. If there are instructions or cautions you want to emphasize, include those as well. Also, make sure that your patient feels encouraged to ask you questions about medications specifically. For example, "You seem uncertain about this medication I'm suggesting. It could have a different name in Korea, or you might have been prescribed something else. What questions can I answer for you?" Some international students may expect to get medications directly from you, or could be confused by the U.S. distinction between prescribed and over-the-counter medications. Be prepared to explain as needed. They may also need assistance with directions to a nearby pharmacy. If you are prescribing a controlled substance, make sure your patient knows to take along identification. This video has presented 3 strategies for communicating with international patients. Used individually or in combination, they can help you promote antibiotic stewardship with your patients. A. Learn from your patients. B. Explain antibiotic stewardship. C. Provide extra help with medications. For additional materials to develop this and other communication skills for antibiotic stewardship, visit the following website.